Welcome to the Deep Dive. We're here to help you get right up to speed on critical topics. Today, we're diving into something called calf enteritis. You probably know it better as scours. And look, this isn't just a minor tummy ache for a few calves. This thing is a huge global challenge in livestock. It causes a lot of sickness, a lot of deaths, and, well, big economic losses and welfare issues too.
Exactly. And our mission today really is to unpack this. It's incredibly complex, this web of factors behind the disease. We'll look at the specific bugs involved, the pathogens, the environmental conditions, which are crucial, and then, the really practical stuff, the latest on diagnosis, treatment, and maybe most importantly, prevention. And we're drawing all this directly from the source materials provided so you get the clearest, most useful insights. No fluff.
Okay, calf diarrhea sounds simple, maybe, but the sources make it clear it's really not. So what's the main thing we need to get about why it's so complicated?
Yeah, the key thing to grasp is that it's hardly ever just one single cause. It's almost always an interaction, a complex interplay between the calf's own body, its physiology.
How it's built, basically.
Right, its biology. Then you've got the infectious agents it might pick up and the environment it's living in. Think of it like a three-legged stool. If one leg's wobbly, the whole thing can easily fall over.
So this inherent vulnerability of the calf, that's kind of the starting point for everything else, isn't it? What makes a newborn calf so prone to this?
Well, a newborn calf comes into the world with its immune system sort of on standby, its gut lining, the gastrointestinal barrier, it's still developing, and the immune system itself is pretty immature. And here's a really critical point. Those immunoglobulins, the antibodies that give passive immunity borrowed protection, essentially they can't cross the placenta in cows.
Ah, okay. So unlike humans, they don't get that protection before birth.
Exactly. They're born completely without maternal antibody protection. So that first milk, the colostrum, getting that right after birth isn't just, beneficial. It's absolutely vital. Critical for survival, critical for kickstarting their immunity. It really is their first vaccine.
Right. So they start with that biological blank slate. But our sources also flag other things, non-infectious factors that make them susceptible. What are some of those management or environmental issues that can cause problems?
Yeah, good point. The environment matters hugely. Even if you nail the colostrum, things like poor sanitation, obvious one there, stressors like overcrowding, sudden changes in diet, even just being exposed to cold, wet weather, all these things can knock down a calf's defenses and make it easier for disease to take hold.
Okay, so we've got the vulnerable calf, the environmental challenges. Now, what about the actual invaders, the microscopic culprits that cause the scours? Let's talk about this rogue scalar.
Yeah.
I gather it's quite a mix. Viruses, bacteria, parasites, and often it's not just one bad actor, right?
Oh.
Especially in those really young calves.
That's spot on. Co-infection, finding multiple pathogens at the same time is very common, particularly in calves less than, say, 2 weeks old. And yes, it's a really diverse bunch. Each one has its own way of causing trouble. So let's maybe break down the main players, look at what makes them tick, how they cause disease, and importantly, the age they usually hit. Starting with the viruses. Rotavirus, specifically group A, that's the most common viral cause. You typically see it in calves around 5 to 14 days old. How it works is it destroys the mature cells right at the tips of the villi, those little finger-like things in the gut that absorb nutrients. So that leads directly to malabsorption. They can't get the goodness out of their food and what we call osmotic diarrhea. Basically, the damaged gut pulls water into the intestine. Clinically, you see that classic watery, yellowy white diarrhea, dehydration, weakness. Then there's bovine coronavirus. This one tends to affect calves a bit older, maybe 7 to 21 days. Its mechanism is similar, attacking the villi, but it can also hit the large intestine. That often means a more severe, longer-lasting illness. You get profuse, watery diarrhea again, sometimes yellow, green, even bloody looking, and they just don't want to eat. Anorexia.
It's interesting how specific the ages are for some of these. But correct me if I'm wrong. These viruses, they don't always kill the calf directly, do they? What's the real danger then?
You've nailed a really crucial point there. What's fascinating and quite scary is that rotavirus and coronavirus often have, negligible direct mortality. They don't usually kill the calf outright. But the damage they do, that villus atrophy, it severely messes up nutrient absorption. This can lead to intestinal acidosis, and then that can cause the calf to lose its suckle reflex. It just stops wanting to drink.
Ah, so it can't take in fluids or nutrition.
Exactly. And that's what ultimately leads to the severe dehydration, starvation, and often death. Even if the virus itself wasn't lethal, it's a kind of hidden indirect effect that's deadly. And then there's BVDV, bovine viral diarrhea virus. It plays a slightly different role, but it's still really important. It often acts as an underlying factor. It causes immunosuppression. It weakens the calf's immune system.
Making it easier for other bugs to jump in.
Precisely. It makes them much more vulnerable to getting hit with co-infections, like common things like E. coli or crypto.
Okay, so the viruses are kind of insidious, starving them indirectly. How do the bacteria compare? Are they generally more aggressive? Do they work differently?
They often work quite differently, yeah, and frequently have a more direct punch. So moving on to the bacterial side. First up, enterotoxigenic E. coli, or ETEC. This is a big problem right in the first few days of life, usually hitting calves 1 to 4 days old. Its method is pretty specific. It uses these little sticky bits, fimbrial antigens like K99, to latch onto the gut cells. Once attached, it pumps out toxins, specifically heat-stable toxins, or ST. Now, this is important. ST doesn't just block absorption. It actively makes the gut secrete chloride and bicarbonate out, and it stops sodium from being absorbed in.
So it's actively pumping fluid out of the calf.
Exactly. It forces water and electrolytes out. That's why they dehydrate so incredibly fast, even if they seem to be drinking. Clinically, you see that watery yellow diarrhea, rapid dehydration, they get cold, hypothermia, and death can follow quickly. Interestingly, you often don't see major damage, gross lesions, in the gut itself with ETEC. Then you have salmonellosis, caused by various Salmonella enterica types. This usually affects slightly older calves, maybe 2 to 12 weeks. Its strategy is different again. It actually invades and multiplies inside the gut lining. This causes severe inflammation, necrosis, tissue death, and it can even spread into the bloodstream, causing septicemia, a whole body infection.
Wow.
Yeah. Signs are foul-smelling diarrhea, often with blood or mucus in it, fever, loss of appetite. But here's a tricky bit. Salmonella can sometimes be found in healthy calves, too. So just finding it in a sample doesn't automatically mean it's the cause of the scours. You need to look at the whole picture, the clinical signs, everything. A holistic approach is key there. And finally, in the bacterial corner, we have Clostridium perfringens, especially types B, C, and D. These guys cause something called enterotoxemia, often hitting calves in the first few days. They produce powerful toxins very quickly, leading to necrotizing enteritis literally, the gut tissue dying off, severe bleeding, hemorrhage, and systemic toxemia. The signs are often sudden death, intense abdominal pain, bloody diarrhea. And what's really grim here, the prognosis is incredibly poor. In severe outbreaks, you can see 80 to 100% of affected calves dying within just 48 hours. It's brutally fast and deadly.
That's a really scary list of bacterial threats. They sound much more directly destructive than the viruses. What about the parasites? What do they bring to this lovely party?
Right, the parasites. Cryptosporidium parvum, that's a big one. It's a protozoan parasite. It usually affects calves around 1 to 3 weeks old, but older ones can get it too. It invades the surface of the gut cells, the microvillus border, causing villus atrophy, again, messing up absorption, and also triggering a secretory response, so more fluid loss. Clinically, you see lots of watery diarrhea, often yellow or pale, and dehydration. But crypto also has this significant long-term hit. This is quite stark. Severely affected calves can end up being 34 kilograms. That's about 75 pounds lighter than healthy calves by the time they're 6 months old.
Wow, 34 kilos lighter. That's huge.
It is. It shows that economic impact goes way beyond just surviving the initial sickness. It affects their whole growth trajectory. And then there's Eimeria species, the cause of coccidiosis, also protozoan. These usually hit older calves, typically over 2 months, but under a year old. The signs there are often dysentery, so diarrhea with blood and mucus and straining, what we call tenesmus. Sometimes you even see nervous signs with coccidiosis. And just briefly, we should mention there are other, maybe less common or emerging things like E. coli, which includes EPEC, and Campylobacter. They can also play a role. The list keeps evolving.
Okay, so we've got this diverse lineup of viruses, bacteria, parasites, each with its own attack plan. What does this all mean when it comes to actually diagnosing what's wrong with the sick calf? Beyond seeing the obvious, like the diarrhea, the lethargy, not wanting to suckle, what are the key things for vets?
Well, those clinical signs you mentioned are definitely the starting point. The physical exam is paramount. But here's a really, really critical distinction that needs to be made during diagnosis. Are we looking at primary diarrhea, probably caused by one or more of those gut pathogens we just discussed? Or is the diarrhea actually secondary to septicemia, a bacterial infection that's gone systemic, spread through the whole body?
And why is that distinction so important?
Because it massively impacts the prognosis, the likely outcome, and it directly tells you what the appropriate treatment is. The physical exam is honestly the single most powerful tool for making this call. You're looking closely at the calf's overall demeanor, its ability to suckle, whether it can stand, and there are specific signs that point towards septicemia. Things like scleral injection redness in the white parts of the eyes, omphalophilitis, which is an infected navel, polyarthritis, swollen joints, hypopyon, pus in the front chamber of the eye, fever, or signs of meningitis. Spotting those tells you it's likely systemic, and that directly informs whether systemic antimicrobials are needed. It's also crucial for avoiding unnecessary antibiotic use, fighting that resistance problem.
And I suppose the calf's age gives some clues too, as you mentioned earlier.
Absolutely. Age is a really helpful first filter. If it's a calf under 4 or 5 days old, E-tech and Clostridium jump higher up the list. Over 5 days, you think more about crypto. Over 7 days, Rota and Corona become more likely. Salmonella, often 2 to 12 weeks. Coccidia, usually over 2 months. It helps narrow down the possibilities right away. Then for lab confirmation, these multiplex real-time PCR panels are fantastic tools now. They can test for multiple common viral and protozoal agents at once. They're very sensitive, very specific, and they give you results fast, which allows for really rapid, targeted treatment decisions. But getting a good sample is crucial for these tests. You need a decent amount, say 10 grams or more, of fresh feces from calves that haven't been treated yet. If you're using swabs specifically for PCR, they need to be moist and definitely not put in bacterial culture medium that messes up the PCR test.
Okay.
And getting the sample to the lab quickly is vital. The diagnostic value drops off pretty fast within about 12 to 18 hours, so speed and care in collection and shipping are key.
That diagnostic precision sounds like a game changer. Okay, so once we have a diagnosis, or at least a strong suspicion, what are the go-to treatment strategies? What works best?
Number one, without a shadow of a doubt, is fluid and electrolyte therapy. That is the absolute cornerstone of treatment. It does several things. Rehydrates the calf, restores blood volume, corrects acidosis, that buildup of acid in the body, fixes electrolyte imbalances, gives them some energy, and helps them feel less depressed. We have to remember, circulatory collapse where the cardiovascular system just can't keep up, that's the most common reason these calves actually die.
Right, so fluids are literally life-saving.
Absolutely. Now, for mild to moderate dehydration, if the calf can still suckle, oral rehydration solutions, ORS, are the way to go, but the details matter. The ORS needs enough sodium to replace what's lost, glucose to help absorb the sodium and provide energy, and an alkalizing agent like bicarbonate or acetate to counteract the acidosis. And here's something interesting. Sometimes hypotonic ORS, solutions less concentrated than the calf's blood, can actually work better than hypertonic ones.
Why is that?
Well, they can encourage water absorption more effectively. If you do use a hypertonic ORS, one that's more concentrated, it's absolutely critical that the calf also has free access to plain water. Otherwise, you risk causing hypernatremia, dangerously high sodium levels. So it requires careful management. Precision matters. Now, for severe cases, calves that can't suckle, are down, really depressed, or maybe over 8% dehydrated, that's when you need intravenous IV fluid therapy. Usually balanced crystalloid solutions are used. And again, correcting acidosis is vital, and managing potassium levels is crucial too. You can get both low potassium hypokalemia and high potassium hyperkalemia. And high potassium can be really dangerous for the heart.
Okay, fluids are key. Now, a hot topic these days is antimicrobial use. What's the thinking on using antibiotics for calf scours?
Yeah, it's a really important discussion. There's been a major shift towards much more judicious use of antimicrobials. In the past, they were used quite broadly for calf diarrhea. Now, with antimicrobial resistance being such a huge global concern, that's really being scrutinized. The bottom line is, for most routine cases of calf diarrhea, antimicrobials are generally unnecessary. They don't help against viruses or crypto, for instance. Their use should really be reserved only for cases where you've confirmed a specific bacterial infection, like Salmonella or Clostridium, or where you have strong evidence of septicemia, that's systemic infection.
So, targeted use only.
Exactly. It's all about responsible antimicrobial stewardship. Now, that being said, NSAIDs, non-steroidal anti-inflammatory drugs like Flunix and Megloman, they can be helpful as an adjunct therapy. Studies show they can reduce fecal output and sometimes improve suckling behavior, but you have to be careful with dosage limits.
And what about feeding them during recovery? Any quick tips there?
Generally, the advice is often to withhold milk for a very short period, maybe 12, 24 hours, while focusing on the ORS, and then gradually reintroduce milk or a good quality milk replacer, ideally one with some added fat and vitamins. Getting nutrition back into them safely is important for healing the gut. Oh, and one more thing on treatments. It's also important to know what's not generally recommended. things like intestinal protectants, clay-based products, or drugs that slow down gut motility. The evidence just isn't there to show they're effective, and some might even increase risks. Stick to the proven therapies.
Right. Focus on what works. Okay, so we've talked treatment, but prevention is always the goal, isn't it? Especially with something like scours. What are the absolute must-dos for preventing it?
You said it. Prevention is absolutely key. And the undisputed cornerstone of prevention for calf enteritis is colostrum management. We keep coming back to it because it's that important.
The first vaccine.
Exactly. Calves are born without those maternal antibodies. They need to drink about 10% of their body weight in good quality colostrum, ideally within the first 6 hours of life. Not just drink it, but absorb it. So testing colostrum quality, maybe using a colostrometer or a refractometer, is important, and then checking if the calf actually absorbed the antibodies, monitoring passive transfer by testing their blood serum total protein levels when they're a couple of days old. That feedback loop is crucial.
Okay, colostrum first. What else? Vaccinations.
Yes, vaccination protocols are another pillar. This usually involves vaccinating the pregnant cow, the dam, during her dry period. This boosts the antibody levels in her colostrum, which then get passed to the calf. There are also oral vaccines you can give directly to the calf right at birth, which help provide localized immunity in the gut against specific bugs like rotavirus, coronavirus, or ETEC. Working closely with a veterinarian is key here to figure out which pathogens are the main problem on a specific farm and tailor the vaccine strategy accordingly.
Makes sense. And then there's the environment itself. Hygiene.
Oh, massively important. Biosecurity and hygiene are critical. The goal is to create a clean break, separate the newborn calf from the reservoirs of pathogens, which are often older animals or contaminated environments. So practical measures include things like making sure calves are born in a clean area and moved out quickly, keeping calves separate from older cattle because adults can shed pathogens without being sick themselves, thorough cleaning and disinfection of feeding equipment, calf pens, everything. If you feed waste milk, pasteurizing it first is a really good idea. And just basic stuff like preventing manure contamination of feed and water. It sounds simple, but consistent execution is vital. And don't forget other factors like good nutrition for the cows before they calve and minimizing stress on the calves, avoiding overcrowding, damp conditions, extreme temperatures. It all adds up to build resilience.
Okay, so a multi-pronged approach to prevention. Now, looking beyond the immediate illness, what's the long-term picture for a calf that's had scours? Is it just about whether it survives the first few weeks, or does it have lasting effects?
That's a really insightful question because it's definitely not just about immediate survival. The prognosis, the outcome, it varies a lot depending on the cause, as we discussed. Some pathogens like Clostridium perfringens can cause devastatingly high and rapid mortality, 80 to 100% in 48 hours, remember? But then others like Rota and Corona, they usually have negligible direct mortality.
Right.
And this is the crucial, but even if the calf survives the acute phase, what are those hidden long-term costs? And the sources are clear. There are profound and lasting effects on growth and future productivity. Let's go back to that cryptosporidiosis example. Those calves being potentially 34 kilos lighter at 6 months old. That's a massive setback. It delays when they're ready for market or when heifers can join the milking herd. It shows the damage ripples out long after the diarrhea stops. Even the infections that don't kill directly, like Rota and Corona, they still lead to reduced growth rates. So the true prognosis for calf enteritis isn't just about life or death in the first few weeks. It's about minimizing both that acute mortality and these significant, costly, long-term production losses. The impact can really shadow that animal for a long time.
Well, this has certainly been a deep dive. We hope we've managed to unpack the really complex world of calf enteritis for you today. From understanding those tiny pathogens and how they work right through the big picture management and prevention strategies, our goal was really to give you that comprehensive view.
Absolutely. And just to reiterate, tackling calf enteritis successfully really demands an integrated, proactive approach. You need to combine that solid scientific understanding with rapid diagnostics, making smart, judicious treatment choices, and maybe most importantly, rigorous, consistent prevention. It's all about understanding that intricate dance between the calf, its environment, and the pathogens. Getting that right is key.
And maybe a final thought to leave you with. Think about how this complex issue, calf enteritis, requires such a holistic view, looking at the animal's biology, the dynamics of the microbes, the environmental management, all interconnected. How often, maybe in other complex problems in health or even environmental issues, do we tend to focus just on the immediate symptom, instead of digging deeper to understand and address those underlying systemic interactions, something to ponder perhaps? What might we learn by taking a truly deep dive more often?